Welcome to This Week in Turkey. Record rises in daily COVID cases were reported in at least 7 countries in Europe this week, and Turkey was among them.
As the Omicron variant surges throughout the world, Turkey sees a new surge in numbers. As of this Wednesday, the Health Ministry is reporting 83% aged 18 and over vaccinated with 2 doses and 92% received at least 1 dose. Between December 18th to the 24th, the ministry is reporting 2.4 million tests, 130,000 cases, 7,800 patients admitted, and 1,205 deaths. The ministry is also reporting 3.9% pneumonia, 55.7% bed occupancy, 69% ICU occupancy, and 30% of ventilators in use. According to the map released by the ministry, the highest number of cases per 100,000 are seen in the northwestern parts of the country, where it is the most densely populated, where inner and southeastern parts of Turkey are reporting the lowest cases per 100,000 residents.
Aziz vatandaşlarım, çok değerli.
On Wednesday, during the Coronavirus Scientific Advisory Board meeting, Health Minister Fahrettin Koca stated the following. As it was expected, the Omicron variant has caused a significant increase in cases. The increase in the number of cases has not yet reflected to hospitals at a similar rate. No significant increase in hospital workload has been observed in Istanbul, where the Omicron variant is the most prevalent. Minister Koca also announced that quarantine times would be cut. Given the current conditions, it has been decided that it would be appropriate to reduce quarantine times. Quarantine period for positive cases has been reduced to 7 days. Koca also went on to assure that face-to-face education in schools would continue. Mask use, hygiene rules, and full compliance with ventilation rules are required in our schools. Face-to-face education will continue in our schools. Our schools will not be closed until all businesses in the country are closed. Meanwhile, Turkey begins rolling out the domestic vaccine Turkovac. After receiving emergency approval, the vaccine became available to the public this week. Dr. Aykut Özdarendeli's team from Erciyes University, the institution that jointly developed the vaccine, stated that they observed 100% protection against both the Delta and Alpha variants in transgenic mice. However, no word on the effectiveness of the vaccine against the Omicron variant so far.
Facing elections at some point in the next 18 months, coupled with the worst economic crisis of his nearly 20-year rule, President Erdogan is looking to neutralize the threat from an opposition that seems well positioned to challenge it.
It was another heated week in Turkish politics as the AKP, MHP, and CHP Party coalition exchanged words and threats. President Erdogan spoke at his party's extended meeting of provincial leaders on Tuesday and made remarks that some interpreted to be threats. President Erdogan remarked, "Without shame, they say that they are going to spill out onto the streets. Oh, do you not remember what happened on July 15th? You can spill out, wherever you are going to spill out. Just like how this nation taught a lesson to those who spilled out onto the streets on July 15th. If you take to the streets, you will also learn your lesson. We, as the Republican Alliance, will chase you down all the way to wherever you end up." Main opposition party CHP chair Kemal Kılıçdaroğlu and its coalition ally Party chair Meral Akşener fired back at President Erdogan, threatening that should the opposition spill onto the streets in protest, they would be dealt with. Kılıçdaroğlu said that we will do what is necessary at the ballot box, while Meral Akşener insisted that they never called for people to spill out onto the streets. Kılıçdaroğlu fired back with a far calmer demeanor the same morning. Kılıçdaroğlu responded, "The gentleman seems to want us to go out onto the street. He's going to push, but we're not going out. We'll do what we must at the ballot box." Kılıçdaroğlu added that he greeted Erdogan's statement with a smile. As if he told anyone to take to the streets. Quite the contrary, we are calmly waiting for the election. When the election comes, you'll simply cast your vote and you will swap this authoritarian government with a democratic one. Party chair Meral Akşener was far more fiery than Kılıçdaroğlu, saying that the president should seek psychiatric help. "Nobody has said that we should take to the streets. No one has uttered these words. It's ridiculous no matter how you cut it. I recommend that dear Mr. Erdogan seek psychiatric help because this is the behavior of a person who is seeing things.
Turkey's yearly inflation climbed by the fastest pace in 19 years, jumping to over 36% in December.
According to data from the Turkish Statistical Institute, inflation is up by 13.58% for the month of December, and the annual inflation rate was released as 36.08%. PPI was reported as 19.08% in December and 79.89% for the year of 2021. The TSI reported annual core inflation at 31.88%. Consequently, this is the highest reported annual inflation level since September 2002. According to the data, compared to the same time last year, the main groups with highest increases were transportation at nearly 54%, food and soft drinks at nearly 44%, household goods at 41%. The lowest annual increase this year was in the communications main group at 8.76%. Other main groups with low growth price increases compared to the same time last year were education at a little bit over 17%, alcoholic beverages and tobacco at 20%, and clothing and footwear again at 20%. According to the Inflation Research Group, an independent group of academics and economists, inflation rose by 19.35% in December and 82.81% for the year of 2021. In addition, on Monday, special consumption tax levied on alcohol and tobacco increased by 47%, a record in recent times. Licensed alcohol and tobacco sellers or tekels of Turkey vowed that they would close the doors in protests on the same day. The president of Tekels Association posted on social media, "This protest is against ever-present hikes and exorbitant prices. Subsequently, it is a stance against companies limiting the supply products or not supplying them at all. The cheapest beer is 22 liras now. This is an intervention into our personal lives."
Faced with soaring inflation and sliding approval ratings, President Erdogan has set up an unusual new culprit. Dogs, literally.
President Erdogan involved himself in yet another facet of political discourse last month. This time, the president took aim at stray animals. Turkey is famed for feral dogs and cats that freely roam the streets. Feral cats of Istanbul alone are estimated to be from hundreds of thousands to millions. Though for many years, the Istanbul Metropolitan Municipality has collected and nurtured the animals, they are released back onto the streets afterward, as the Turkish public is generally known to detest keeping animals in cages or euthanizing them. Last month, however, the matter of stray dogs came back into the discourse as a 4-year girl, Asiye Ateş, was attacked by an unleashed pet pit bull in the Gaziantep province. The incident caused nationwide uproar and even drew President Erdogan himself into the conversation. However, the president's remarks on the situation also garnered criticism and speculation. Speaking at a rally in Gaziantep, President Erdogan warned, "These dogs belong to those with money. I call on to our municipalities to take the necessary steps to remove these animals from our streets. White Turks, mind your animals." What garnered the most attention was President Erdogan's use of the phrase "White Turks." Colloquially, White Turks are used to refer to well-off, secular Western Turks, where in contrast, Black Turks, a mostly pejorative term, refers to conservative, religious, and working-class people. President Erdogan garnered wide criticism as many interpreted the president's words as trying to drive a further divide in the Turkish cultural psyche, particularly at a time where the nation's economic woes have driven the president's numbers down in the polls.
Joining me now, public health expert Nuriye Ortaylı. Dr. Ortaylı, thank you very much for being with us.
Hello.
Welcome. Turkey is one of the countries which is severely hit by the new Omicron wave. But when you look at the streets, or when for most of us we go to the work, life goes, as usual. So what can you say? What can we expect for the, say, next week and for the end of the month?
Well, actually, Omicron came warning that it's coming. I mean, thanks to the South African Republic, we have learned about, and to the scientists and there who had honestly shared everything they found about Omicron with the world, and was unjustly punished for that. The country was punished, but anyhow, so we knew that Omicron was coming, and also we had access to wonderful data from South Africa and also from UK, which was hit a little bit earlier than Turkey, about how Omicron is going to spread. But as usual, I mean, the government didn't act on it. And of course, you don't expect people in the street to follow what's going on in other countries and to, make their own, how do I say, interpretations of data. You don't expect that. A handful of experts, as usual, we try to reach whomever we can reach through social media and like venues, medias like Medyascope. But of course, our reach is limited. And also in December, I mean, everybody, including us, we were so occupied with what was happening economically and financially in the country. I mean, we were going through a deep crisis. We didn't know what's going to happen next day, and we didn't know how we would be able to survive economically in this situation. So the public's attention was not on coronavirus, even if we tried to bring this to the attention of the public. And as usual, Ministry of Health or government, they didn't do anything special, and still they're not doing anything special. They didn't and they don't even warn people that this is serious. On the contrary, we see some experts, I would say, in quotation marks, who come out and declare that this is soft, this is a softened virus, etc., etc. So when did the public in general started paying attention? As usual, like the previous waves, when people around you started getting sick, most of the people at that point, they realized that there is an Omicron wave. So we are in the heat of the wave. I wouldn't say in the middle, but we are already, the cases are increasing very sharply, and this will eventually lead to hospitalizations, even in increased occupancy rate in ICU beds. So I mean, we are in Omicron wave, just as we had been in Delta wave before, or Alpha wave, without warning the public, without getting necessary precautions in time.
To underline your point, this is the headline from yesterday from a government-affiliated newspaper. It says, Turkey cut the quarantine time, saying Omicron is not worrying. Well, this is exactly the English title, so it is, I think, for outside, for tourists, maybe you can come. We don't have even quarantine here. So could you tell us, I mean, what does it mean? How will this cut affect people?
Number one, it's not quarantine time. Even Minister of Health himself declared that it was quarantine time. It's the isolation time, which is, they have reduced the isolation period from 14 days to 7 days, even to 5 days, if you can show a negative PCR result at the end of those 5 days. I mean, we know that this similar issues are being discussed in other countries, in European countries, to cutting down the isolation period, but there is a reason for that. It's not being cut because it is safe to cut. They are doing this because I think in UK it's about 10% of the all healthcare staff is in isolation, and because of that, they're afraid that the hospitals will not be able to cope with the coming wave of hospitalizations. So they decided that if people in isolation, if they don't have symptoms, and if they can show a negative test result, they can start working after 7 days. It doesn't mean that there is no risk of transmission after 7 days. There is. But they decided as a policy matter that this is a risk they can take because otherwise the health workforce will be severely hampered.
Yeah.
And,
I think
we hear this, that European countries is reducing isolation time, and we take it to our country without, looking at the circumstances and also applying to this to everybody. I mean, everybody are not essential workers. They don't have to go to work as soon as possible. They can work from home or so they don't have to be on the street, and it's better to keep them isolated to reduce the transmission, the spread of the virus.
And also, I mean, the government says that this Omicron variant is not leading to a rise in hospitalizations, which is not true, I suppose, or we should expect in coming days. But also we know that our health workers are very in very dire situation. So how do you say? I mean, what will happen to them in the coming weeks?
Well, actually, there are figures. There's data now from several countries that Omicron is not as, how do I say, as violent as, or it's not as severe as Delta in terms of leading to hospitalizations. The hospitalizations are a little bit less compared to Delta variant. So that's good news, actually. Otherwise, it would be disastrous because Omicron spreads so fast. It spreads 2 to 5 times faster than Delta. I mean, in different settings, but especially in homes and in working places. It's once it is in, nearly everybody gets infected. It's very transmissible. So we are a little bit relieved that it doesn't cause hospitalization as much, but it doesn't mean that it's not going to cause any hospitalizations. On the contrary, we have seen in South Africa, we have seen in UK, at a certain point of the wave, hospitalizations start increasing. And it's going to increase in Turkey. And I tell you, the time is around the second week of February. Because just like Wuhan virus, the original virus, in 2020 spring, we met it. We had a delay of about 2-3 weeks compared to European countries. I think that's related to our global connections. We are not as connected as those countries to the other parts of the world. Mainly, we transmit the virus from European countries. I say mainly. They are not the only source, but we have, more closer ties with those countries. So once the virus and any variant is in those countries, it takes about 1-2 weeks. So we follow those countries with a 1-2 week delay. And I tell you, hospitalizations are going to increase, and it's roughly going to be around the second week of February or the first week of February. So we have to be ready to that. But what are we doing for that? We are still treating our health staff. I don't know the word, so rudely, so savagely. I mean, there is violence against health staff, which we see over and over again. It's increasing. And basically, the government is not doing anything about that. The second issue, okay, let's say they cannot control the violence. It comes from individuals. But the second thing we see is that working conditions of healthcare providers are getting worse and worse. And they even played a joke on healthcare providers just in December. First, they promised a rise. Minister of Health promised a rise. It was accepted in the commission in the parliament to give a pay rise to healthcare staff, or mainly it was physicians, I guess. And then it was overturned with no explanation. So they just showed the money and they pulled it back. And working hours are extremely long. I mean, they say we are ready. What is ready is ICU beds themselves, but the healthcare staff numbers have not increased. On the contrary, it's decreasing. People are resigning, and they have resigned and keep on resigning from public service healthcare providers because of the working conditions. Some of them are leaving the country. We have seen the highest immigration of last 50 years this year. Yeah. More than 1,000. I think it was 1,300 physicians left country in 2021. So the morale is very low. They are very tired. They are exhausted. And we also have to remember we lost about 600 healthcare providers to COVID in this country. And they are not, I mean, even their memories are not respected because their families are not getting the grants they should, or the support they should receive because these people died on the job. So there are a lot of issues which makes healthcare providers unhappy. And I must tell you, the morale is very low among the ranks.
And maybe I should ask, how is the vaccination efforts going? Do you think we could catch up with the World Health Organization's, 70% in at least in this year of the
70% vaccination rate is the target, and of course, maybe if we can, we should have higher numbers. Why not? But actually, what's happening is the Ministry of Health keeps vaccinating and revaccinating the same cohort of people. I mean, there is about 35% of the people who have never been vaccinated, and they're not getting vaccinated. And I need to tell, I mean, vaccine hesitancy could not be as high as this if there was a proper mass campaign to inform people, to fight the rumors, etc. For some reason, which I cannot understand, the government doesn't take an active role in, dismissing the myths and fighting against those false rumors created by a small group, a minority. And they are not proactive in this. They haven't been proactive. It's hard to understand because, in my opinion, it was possible to vaccinate that 35-40% during summer months with a reasonably well-organized mass campaign to inform people about the benefits and safety of vaccines. That hasn't been done, and nothing is being done. So they're giving boosters to people who have been vaccinated again, which is not as valuable as vaccinating people who hadn't had one dose. It's more important to reach those people if we really want to break the transmission down, if we really want to reduce deaths.
And last question. The government was very proud that a Turkish vaccine will be coming to the public, and maybe they are planning to have this campaign for this vaccine. But there are some, the health authorities say there are some problems with the data regarding this vaccine, how much effective it is. What can you say about that?
Well, it's good that, there's work going on vaccine development in Turkey because this was an area long neglected during the last 2 decades. We had vaccine production capability before that, but unfortunately it was considered to be unfeasible and they just dropped the ball. It's good that now there are vaccines coming out, and Turkovac Turkovac, it's named, I guess, the one which is the first to hit the line. But Turkovac is not the only example. There are other vaccines also in development and which look very promising. So we are happy about that. But unfortunately, and also the Ministry of Health has given emergency use authorization to this Turkovac new vaccine. But I cannot comment on it because I haven't seen any data. I'm not as a peer-reviewed article, not even as a report shared with the public. And I know that, medical association and several professional organizations have applied to Ministry of Health several times asking to see the data. And data wasn't shared even with them. So really, it's not possible for me to comment. But if you ask me that you want to get the vaccine tomorrow, I would say just wait a little bit because we don't have the data. I haven't seen the data yet.
I know I said last question, but this data thing, throughout the pandemic, Turkish authorities were very stingy on their data. They don't share anything with the public, or if they share, they're always missing some real data.
Bits and pieces,
Yeah. So how does this affect for, so we cannot even plan, can we? Or what I'm saying is that do they keep the data and do not disclose to the public, or they don't have they don't do it properly to keep it?
I think both. Because, at the beginning of the pandemic, I thought they have the data, but they share it only within close circles, not to create panic, which I think is still a wrong attitude, because panic is not created because there's information. On the contrary, it's created because when you don't know anything. Fear comes because you don't know something. If you know, you are more, and if you present the data in a comprehensible manner and explain it to the public in simple words, which can be done, which we see that many countries do that, it's not going to create panic. On the contrary, it's going to create a sense of confidence, sense of self-control. They never did this, but I was thinking that at least maybe somebody in the ministries, a small committee is seeing the data and they're discussing it and they're taking the precautions based on that. But I think what we have seen through many examples now made me believe and brought me to the point that they don't even collect and analyze the data properly. Because sometimes from time to time, minister himself shares a few PowerPoint slides with the media and with public, and looking at those graphs, some of the small reports they have prepared, they're pathetic, but they're pathetic, really. They don't look like they have been prepared by people who know what they are doing, who are, familiar with data analysis and etc. They changed the definitions several times. Never those definitions are put in place. Now, for example, from time to time, they share with the public the incidents in certain cities, but that's published 2 weeks later. And if you, in a pandemic, if you share the results after 2 weeks, it doesn't mean anything. Only those people who are infected, they're infected. It doesn't help public and local authorities to take precautions. So those things have to be timely. And actually, Turkey is not a poor country. We have the infrastructure where they can collect data online. It's real time. If something happens, it's real time in a centralized data system. So it's not difficult to, take some of the data and analyze it and put it into meaningful graphs and tables and share it with the public, let's say within 2, 3, the most 5 days. but that's not done. So I really think that there's not capacity in the Ministry of Health to do that. And also their communication ways, I mean, nothing is done properly. I think there is really a problem of competency within Ministry of Health. It's not only keeping the data from the public, which I think is the main reason, but it is being exacerbated by, incompetency in those areas where, they should be collecting and analyzing data in a reasonable way. I mean, they make so simple mistakes which shouldn't be made in, anybody who had taken epidemiology 101 or statistics 101 shouldn't be making. And I'm really surprised because, in my age, when I had contacts with Ministry of Health in 80s, 90s, Ministry of Health was a different place. It wasn't like this.
This competency issue is, we see it, this
all
incompetency, all over the public institutions, the ministries, everywhere. Unfortunately, this is the trend which is taking Turkey down and down each day. Dr. Ortaylı, thank you very much for your time. Thank you for being with us.
Thank you for giving me the time and space. Thank you.
And dear audience, thank you very much for watching us. See you next week.
Türkiye'nin sivil, bağımsız, özgür ve çoğulcu bir medya ortamına ihtiyacı var. Medyascope 20 Ağustos 2015'te bu ihtiyacı karşılamak üzere yola çıktı. Ama yolumuz uzun. Bu yolculukta bize Patreon veya YouTube'un katıl butonu üzerinden katkıda bulunabilirsiniz. Destek verin, sizinle güçlenelim.